if we can use the microphones, because obviously we've got people joining on our marvellous hub in the corner, and obviously they want to hear what's being said in order to respond to any questions. Thank you, Chairman.
So, welcome to the Policy and Scrutiny Committee for Health and Social Care. I think the only person that we probably need to... Pam, do you know your way around the building?
No, I've just been told how to get out.
Okay, all right, okay. And you know where the loos are and all that sort of stuff, right? Okay. Okay, so first item on the agenda is to approve the minutes of the 19th of July. So Michael's proposing. Can we have somebody who was at that meeting? Rodders is standing. So Councillor Lilly proposing, Councillor Downer seconding. I've got to call them by their councillor names.
If you could just sign the top right hand corner or initial the top right hand corner of each page as well. Chairman, we got apologies from Councillor Andrew Garrett, who's unfortunately unable to make it due to work commitments.
Thank you. Declarations of interest. Karen, Councillor Lucioni.
I'll always say I'm a self-employed personal assistant, so a lot of this covers
Thank
that.
you. Thank you. If a conflict arises on the item, just notify if you haven't already. Public question time. Now we have had a question from the public, and it actually concerns an item on the agenda today. But the question is: would the committee please apply pressure to the ferry companies to adopt a patient travel scheme that would give NHS patients, particularly those that need to travel in a car because of surgery, absolute priority on any day and any sailing throughout the year? In view of the reluctance of at least one ferry company to engage with the council to implement such a scheme, I hope this committee can undertake to scrutinise, persuade and apply pressure to these companies to adopt a workable patient travel. And that was a question from Kay Evans. Now the committee has ongoing concerns about the impact of crossing the Solent on patients and their families. It is something that we will be discussing later on in the agenda. These concerns are not only in respect of the financial cost, but the physical impact on patients caused by the stress that such travel can entail, which also involves a mental impact as well. It will request that health partners, the council and all public transport operators engage in discussions on this very important topic and report back to the committee in due progress. So, you know, we're pleased to take that up, and thank you very much, Kay, for asking the question. Now we've done agenda item 4. We've done just a summary sheet of the activity of the committee and what actions and outcomes are. A lot of the work is in progress because that's just the nature of what we're dealing with. But I thought it might be quite a useful reference for people. I guess we only meet once a quarter. So are there any questions on that from anybody like Alison or Darren? We can't hear you. No? No, okay. Thank you. So that moves us on to item 5, dentistry on the Isle of Wight. And we've
got Alison Cross, Chairman.
So we've got Alison Cross. Hello, Alison, can you hear us?
I can, thank you very much.
Yeah. Now we've got some serious concerns about dentistry or the lack of provision for dentistry on the Isle of Wight, and you're going to give us an update, please.
I am going to give you a little bit of an update to where we are. Just bear with me 2 seconds. So I've just got to get my computer to work properly. Just bear with me. All best laid plans when I can't see the document I'm trying to read off of. Do excuse me, because I just want so much to make sure that you get a good update. I've written it down, so I'm going to turn myself to this side because it wouldn't work on my computer. Just bear with me whilst I go through and explain to you a little bit about dentistry, and then explain how we've come to the point that we are at the moment and what happened whilst we were in COVID, and coming out the other side. So NHS England and Improvement is responsible for commissioning all dental services, so that's primary care, community and hospital services. Approximately 70% of our budget is spent on primary care, and 30% goes into treatments that are for additional skill sets that dentists don't have, or into hospital referrals. The vast majority of dental practices hold contracts to undertake NHS services under a general dental service contract or a personal dental service agreement. This means that they're independent contractors and they hold a contract with the NHS to provide a set amount of activity each year. Patients are not registered with a dentist. Many people think they are, but they're not like when you go to a GP. So you can actually go to any dental practice to have your treatment. The NHS holds contracts with practices to provide what we call mandatory dental services. However, it's important to understand that there are different contract sizes, and these are based on historic provision in 2006. So although two practices may be in the same area, they may have the same number of services and look very similar, they may not have the same level of NHS activity to be completed throughout the financial year. Attendance at a dental practice is based on a person's own clinical need. So where we've heard previously that someone should go to the dentist every 6 months, that isn't technically true. NICE guidance says that intervals can be anywhere between 3 to 24 months, and it is based on the clinical need. So you could have two people very similar age-wise, and look very similar, but actually their oral needs might be very different. So they may have a different recall time, which could be anything between 3 months to 24. So it's really important that people understand that it isn't that 6 monthly recall that has always been drummed into us, because that isn't the case, and that's been the case since 2004, that dentists should be working towards an individual clinical oral assessment and your own individual recall. It's really important to make sure that when you go to the dentist that the treatment that you have done is completed. So it might take more than one or two visits to have that treatment, and the dentist will make you orally fit at those appointment times. However, saying that, I do understand that the pandemic has hugely affected how dentistry is operating. And as you know, all practices were asked to close between the 26th of March and the 8th of June 2020. During this time, they only could provide advice, analgesia and antibiotics over the telephone. The South East Dental team, which I work for, put in urgent care hubs so that patients who weren't helped by antibiotics, weren't helped by advice or analgesia, were able to have a treatment. These hubs remain active today, but I'd like to explain a little bit later on how we're operating those now, because they're not seeing patients in the same way as they were whilst the pandemic was going on. As practices have begun to open in June 2020, and I know we're going back to June, so that does seem a long, over a year ago, but it is important to understand how this has impacted on dentistry. The Chief Dental Officer and Dental Public Health advisors sent out a standing operating procedure which had to be followed by all dental practices who were going back to seeing patients face to face. This outlined an enhanced infection control procedure with all dental practices had to follow when they're treating patients. Practices were also asked to ensure that when patients attended, they adhered to the government social distancing requirements, and many practices had to put other things in places like making sure you entered through one door and left through another and put up partitioning screens, these sort of things. This operating procedure, not only did it give guidance on how to see and treat patients, making sure that you kept to all of the PPE requirements and enhanced infection control measures, it also laid out the priority to see patients. Priority was given to patients who were in pain and had an urgent need, and then to work through the backlog of patients who were halfway through a course of treatment when the closures happened. The groups then came down to vulnerable groups. So that could be someone who's suffering from cancer, who needs treatment to be undertaken so that they can have their cancer treatment. Vulnerable people, asylum seekers, refugees, children, looked after children, these types, and then normal children, pregnant mothers and nursing mothers. So there was a lot of people who needed treatment. We absolutely get that and understand that. I wanted to explain to you about the fallow time because this is really important for everyone to understand, because this is how it has really impacted on the services. Fallow time was firstly set at 40 minutes, so it was later reduced to 20 minutes. But what happens within the fallow time is that when a patient is treated and certain aspects of dental treatment produces particles that go up into the air, and these particles have to come down and settle before the area can be cleaned. So it's really important to make sure that these were all left to settle, and this is where this 40 minutes settling time came from, this fallow time. That's now been reduced, as I say, to 20 minutes, and some practices have put in extra equipment to bring this down even further, so they are able to begin to see more patients. This procedure had to be undertaken so that the spread from patient to patient and to the dental team was minimised. Dental practices also had to make sure that they had the correct PPE, and many of them would have to wear FFP3s. Now these are like you'd seen in the hospital when they were dealing with COVID patients, and not like the masks that they wear when we are seen by them, or what we have used to go to the shops. They purify the air that they are breathing and make sure that they're not breathing any of the particles and vapours that are given off by the patient. And it's really important to understand that that is still happening in some procedures that are undertaken by the dentists. So normal routine of us going back and seeing a dentist is going to change because they aren't in a position under the current guidance to be able to see the numbers of patients that they were previously seeing. So it is going to take us some time to get back to normal, and where normal is going to sit, I don't actually know. At the moment, dentists are being paid their total contract value. They have to achieve 60% of their activity. There's no indication as to when this will change. It was less last year, it was 45%. This half of the financial year, it's 60%, and we're waiting for a decision on this next half from October to March, whether that stays at 60% or whether it is increased. So nationally, we're waiting for that at this moment. To help with access issues, because I absolutely get it, there are access issues out there. We have offered funding for practices to undertake additional hours. So these are outside of their normal contracted hours. But it has to be recognised that many practices are struggling to even do these additional hours to help us out. And that's because the majority of their staff have been working with the PPE, wearing the the PPE equipment, masks and other attire, and they are physically and mentally and emotionally drained at this moment in time. We did have some practices on the Isle of Wight who offered to do these additional sessions, but unfortunately only lasted a couple of weeks and then they pulled out. So the offer is still there for any practices who feel that they have the ability to undertake any additional sessions. Our doors are open, they can always talk to us, but unfortunately at the moment we haven't had anyone who's come forward to say that they can do that for us. Across the whole of Hampshire and Isle of Wight, before, when the services were under Wessex and not called South East Region, there was some additional funding that was offered where practices had given back some of their activity, and some of them were closed on the mainland. The Wessex team gave out these additional funding slots. It roughly around about 980,000, and we have kept those going. These have been refunded until March 22, and that comes into our timeline of where we are looking at recommissioning. And I will actually be attending a meeting tomorrow to look at how we are going with the commissioning of new services and where these are likely to be, because we need to undertake a needs assessment to ensure that we are getting them right and putting them in the right place for the right people to attend.
Thank you, Alison. Are you ready to take questions?
I am. Sorry, I do apologise for rambling. I just wanted to make sure that you understood where we are with the dental at the moment.
Right, I've got Councillor Mosdell, and then I've got Joanna Smith from Health Watch, and I've got Councillor Lilly.
Okay.
Good evening, Alison. I'm not sure if you actually had a copy or read the report that Health Watch did on the dire situation that we are actually in with dentistry on the island. Thank you for your answers you've given, but it doesn't seem to correlate to the really good report and the time that was spent by Health Watch demonstrating what the situation we are in. You have lots of stuff about what COVID does, and to be fair, I get a little bit tired of hearing it's because of COVID, because actually you couldn't get a dentist on the island for love nor money pre-COVID. So it's a situation that has been going on for an awful long time. I'll give you a perfect example. Well, I tell you what, toothache actually is nearly as bad as giving birth, and I hated being pregnant, so I can tell you that is true. You can't get away from it. It just can drive you. You know, it is agony to have toothache. My daughter is a single parent on benefits. She had the most horrendous toothache recently. Our dentist that we would have been registered, she was registered with an NHS dentist on the island. That dentist has now left. She was told her nearest appointment would be October the 15th. I don't know anybody around here who wants to put up with toothache until October the 15th. It's not going to be something to happen. She's lucky that, you know, she's got a mum like me who paid privately for her to see one. But otherwise, she would still be in agony trying to see a dentist. And it would have been the same pre-COVID. You know, this is a situation across the island that has gone on for at least 6-7 years now. So thank you for your presentation, but I don't think we've quite got to the crux of it. And I do have a feeling that the time and effort that was put into Health Watch's report hasn't actually been properly digested. Thank you.
Thank you, Councillor Mosdell. I've now got Joanna Smith from Health Watch.
Thank you. So thank you for the update, Alison. It was useful, but I've got to agree with Councillor Mosdell that we've had a real issue with NHS dental services well before COVID. And in fact, that's why we undertook some work years ago on this subject. COVID has just exacerbated the situation. And I think we need to acknowledge the particular problems we face as island residents. So I acknowledge there's a national problem with recruitment of NHS dentists. However, we can't go to our neighbouring town. We can't just pop over to Southampton, Portsmouth without incurring costs, without taking half a day off work, as our mainland residents can do. it's a lot easier for them to find an NHS dentist that is accessible to them. We haven't got that over here. So, and I recognise that a lot of the solutions are strategic and can't be done without national change. However, there are some things that can be done right now by working with local dentists, and we've spoken to a lot of dental providers and they're really keen. They know what the issues are. They want to help people. So my real question is, when are you doing the oral health needs assessment? Because it's essential that is done as soon as possible, so that we actually know what the need is, what the issues are, where the gaps are. And I will continue to say it, but dental services are the biggest health inequality we've got on the island. So if you've got money, you get a service tomorrow. If you can't pay for it, unfortunately, there aren't any NHS dentists taking on new patients at the moment, so you won't get a service. And again, I'm aware that it's a national problem, but it's just exacerbated on the island, and it's a huge problem that impacts on primary care, it impacts on the trust, and of course we've got people suffering and have been suffering for a long time. So can you tell us when you'll be doing the oral health needs assessment, because that's the key to unlocking some of the solutions that we need to find.
Thank you, Joanna, and I expect you noticed there, Alison, that all the councillors of the committee were nodding their heads in agreement with what Joanna said. Are you able to answer any of those?
Okay, so the oral needs assessment for commissioning new services is starting literally tomorrow is our first meeting, where we will start to look and plan and look at data as to where services there is a reduction, and what we can do to actually put that, put more services in place. What we need to do is understand from our public health colleagues the data that helps to substantiate where these should be. So that would be looking at the deprivation of areas, looking at the deprivation of need assessments, sort of that is published online, and building into that, where are the gaps? So we're aware that there are issues, and obviously I'm quite new to the Isle of Wight, coming over into this area, but I have been told by my colleagues that it has been an issue for some times. What I seem to believe that happens, and tell me if I'm wrong, is that it's recruitment. They can't recruit them to stay. So even though practices might recruit someone, they don't stay that long because of all the issues of the island. It's travelling backwards and forwards. So if people don't want to live on the island, they have to come over from sort of like the mainland, and that seems to be the biggest issue, trying to keep them coming and accessing services for you. My colleagues within the commissioning team, we can't help with actually recruitment, but the national team have been made aware of it, that it is an issue, and there is going to be a national drive to try and get more dentists to come to sort of like the smaller areas. I live on the south coast as well. I live in Kent, so we have pockets of deprivation and also coastal areas. Although we are attached to a mainland, I absolutely get that. So it's not quite the same issue, but there are pockets of deprivation, and we need to make more of sort of getting these dentists to come to these areas so that they can start working for you. So we're absolutely aware of that. It's trying to make sure that whatever we do, if we commission services, that we can actually get dentists to work under them, because looking at the Health Watch report and the response that NHS England gave, it didn't seem to be that there was the number of UDAs that we asked, like the actual activity. It's getting that activity completed. So the money is there, it's just not being able to be utilised, and that's because the dentist can't deliver it.
We've got the Director of Public Health for the Isle of Wight and for Hampshire, Simon Bryant, who wants to come in.
I just wanted to confirm, colleagues, that the public health, we're talking about Public Health England, not the local authority. We're doing our role, just in case there's a bit of confusion there.
Thank you, Simon. Right, now next on the list I've got Councillor Lilly, then I've got the Cabinet Member. Oh, sorry, Joe, did you want to come back on that? So Joanna to come back, then Councillor Lilly, then the Cabinet Member, Portfolio Holder, Councillor Love.
I'm absolutely delighted that an oral health needs assessment is starting tomorrow. That is fantastic news. But I would say you have to engage with the local community. Data only gives you one side of the story, and it doesn't tell about the problems people are having today. So you need to consult with town and parish councillors, with GPs, with the public, because they know where the gaps are. They can tell you what the issues are, and you can't do an oral health needs assessment without speaking to people, parents, families, again, I acknowledge that there's an issue with recruiting dentists, but a lot of work can be done with, for example, Portsmouth Dental School. As far as I'm aware, we only get one dental student per year across to the islands. Work needs to be done on that to make it easier for island dental practices to be able to support trainees. You know, practical things would be helpful. And as I say, local dentists have come up with a lot of solutions. So again, working with the dental community, the local dental committee, because they've got some great ideas for improvements. But you can't do this without engaging with the community. It's one of the most common reasons that people contact us is around the fact that people can't access the dental care they need. And that's true today as it was last year. So, you know, it's one of the biggest issues that island residents are concerned about. So you need to engage them in this and continue communicating with them, because it's a cause of great stress and anxiety to people, not knowing what they're going to do in the future as well. If even the ones that access private dental care are worried about what happens if their dentist retires, if they leave, what are they going to do then? So it's a huge cause of concern to the community. And is something we need to communicate better to the public about.
Thank you, Joanna. And it is refreshing to know that a consultation is taking place in 2 days' time. However, this committee has been raising these concerns over a number of years, in fact, over a couple of administrations, and nothing ever seems to get done. So we need something to be delivered on this. I've got Councillor Lilly next.
I'm not going to repeat what my colleagues have eloquently said, because I think this is, as the chair has just said, this has been on this scrutiny committee agenda for nearly 4 or 5 years, and we've continually highlighted it as one of the biggest health inequalities on the island. My particular point is that because we have had poor service, because we have had people have had difficulty getting appointments and things, many families and the children are not going for the kind of dental care that they should be having as children, right? So they don't have problems in future life. And we've got whole generations, and COVID has just made that worse, right? In the sense of people not, you know, going, because actually most people don't want to go to the dentist, but anyway. And I really do think we have to have a program of re-education, of getting families and people back to actually using a service. But we can only do that if we've actually got the dentists actually there providing the services. So really do want to re-emphasize that we have got a generational problem of our teeth on the island being much poorer than anyone on the, particularly on the south coast and side. And the last particular point, the Chief Medical Officer's report that was about health in coastal communities, I think the Isle of Wight during COVID was actually highlighted. And I think within your health assessment needs, I think it's important that from when you use the word deprivation, we have serious health inequalities and deprivation on this island. And we're talking today about the ongoing, all the time, the cost for people to go to the mainland. They cannot afford it, and particularly the most deprived. And we really do need to prioritise and get you to prioritise that this is a real critical issue, and we are going to have generations of children with the worst teeth in the south if we don't actually tackle the issue now.
Councillor Mostel.
Thank you. Alison, I have a question and an ask. So my first question is, could we have some idea of the timescale of this, how long this assessment will take? You can have some assessments that take 6 months, and you could have one that's going to take about 2 years. So I'd like to have some idea on how long this assessment takes. And then my ask would be, as the senior commissioning manager, could you make the journey to the Isle of Wight to at least meet Alison, at least meet Joanna and her team, because there is nothing like walking in someone's shoes and making to the journey to the Isle of Wight to have some idea how difficult and how expensive it actually is. I think you have to do it. You've got a fantastic role here, but until you make that journey, you will never have that understanding of how complex and expensive it actually is. So one's a question and one's an ask.
Now, I've got Councillor Love waiting, so we'll let Alison respond to that. And we've got the Leader of the Council. Laura, did you want to say something?
Okay. So I'm more than happy to come to the Isle of Wight. I've never been there. I would love to come and meet you all and talk to you face to face. So I'm sure that that maybe the next meeting or the meeting after that will be something that we could look at doing to understand what you all go through. Absolutely. With the commissioning needs assessment that we're undertaking, I'm hoping that it will not be 2 years. I'm hoping more that we will be looking to go out to tender within the next 6 months, because we really know that across the Hampshire, Isle of Wight and other areas within our southeast region, there are still areas of need. So we are pushing forwards with that. There are lots of procurements that we have got to do with sort of like associated services, so not only just what we call mandatory dental services, but the add-ons as well, like oral surgery, where a dentist can't take your tooth out because they haven't got the it's too complex, that they're add-ons as well. So these are all set to be done within the next sort of like year, 18 months. So I'm hoping that this procurement pipeline will feed into that. So we do GDS first, which is our more important, and then the other oral surgeries which support the services for mandatory dental services. So hopefully around about 6 months.
Alison, sorry to be a pain. Can I just have clarity on that? Are you going out? What are you going out to tender for? Are you going out to tender for someone to do the consultation, or?
We will be doing the consultation within NHS England and with our colleagues in dental public health for NHS England. That should take about 6 months, and then we will go out to tender as soon as we can so that we get services in place.
Thank you.
Councillor PC Wilcox, did you want to come in at this point, and then Councillor Love can round up?
Okay, lovely. Thank you very much. Alison, I'm putting major faith in you that you can actually do something, because I've been chasing this at least since 2006. This isn't a COVID situation or issue here. This has been going on since 2006, where we've had less and less NHS dentists. I would say that it's not just deprivation. There's the areas of deprivation. This is across the island in the main, where everyone is having issues. We've got people mending their teeth with super glue. They go to the pound shop and they're getting super glue and mending their teeth, and that's what they're trying to live with. It's also causing issues with people not wishing to go out because their teeth are in such a state they're too embarrassed to go out. Is causing issues there. We've got children that haven't seen dentists in 8 years. The first 8 years of their life, they've never seen a dentist. So, you know, that there is definite issues. I hope that we're going to think outside the box. I hope that when you do come up with a solution, we can have a concentrated team, because it will be too overwhelming to expect the dentist to be able to catch up. We need a whole group of people, and whether they come in for a whole month and come in to support to try and get rid of some backlog, we're definitely going to have to think differently, Alison, because the backlog is so severe. And very much look forward to you. I think you're going to be great. So I'm really looking forward to it. Thank you.
Thank you, Laura. Now, the MP has just put his hand up. Bob Seeley. Bob, would you like to say something at this point? I know you're busy.
Yes, thank you very much indeed, John. Can you hear me okay? I just want to ask just a couple of things just to let you know. I was actually in a bunch of meetings with NHS providers last week, and they're looking at options to get more dentists, mainly from the Indian subcontinent, which are very good dental schools, and actually a little bit of money could get a significant chunk of new dentists into the country, and clearly then to get some for the Isle of Wight. It's a bit vague at the moment because we've got to persuade government to act, and they need to stump up relatively small amounts of money to persuade the General Dental Council, so I'm not quite sure of my terminology, to make sure more places are available on the dental schemes that you have to pass, or the dental tests that you have to pass to be able to practice as a dentist in this country. So there may be some movement on that. I've also been talking with the Public Health Minister, Joe Churchill, several times, again last week was most recently, about public health options such as fluoridization, to see if there are things that we can do on the island which are not just focused on more dentists, although clearly, as everyone says, we need more dentists as well, because that's very important. And just to follow up Claire's question, maybe I misheard. I don't see, I'm just a bit concerned it takes 6 months to put something out to tender. Should we not be getting results? And well done, Joe, for getting this and pushing for this. Should we not be getting the results of the dental needs assessment after 6 months rather than putting it out, or did I misunderstand?
We'll be working on the doing the actual tendering after we've done the needs assessment. So it's important to make sure. Okay. So we do the needs assessment first, and then go out to tender.
Assessment is starting now, which is very exciting. It's something that obviously we're all very keen to get, and then the tendering process. But the problem is we still need to be attracting dentists, and it's not just the island. Cornwall's got dental problems. East Anglia's got dental problems. Areas of Kent maybe as well. I'm not quite sure. So there are chunks of the UK that it's just difficult. There is a shortage of dentists in many parts of the UK. Okay, look, I'll keep working on it my end, and hopefully we will, frankly, get more dentists and get more people to have more dental care at the end of this process. So thank you all.
Thanks for your support, Bob.
Thank you.
Now, Councillor Love, Cabinet Member, would you like to round up, President?
Thank you very much. It seems that we're all speaking from the same place, aren't we? We're all very much saying some of the same things about what we're experiencing. So this is not just about dentists, though. Although we have a problem recruiting dentists, it's not just about dentists, because I know that, and I've had this from people out in the community, that if they go along and try to get an NHS appointment, it's just not available. But as soon as they offer to pay, then they can get the treatment straight away. So that's a really serious thing that we need to address. Now we've defined the problem, I think here, everybody very, very well. It's all about the solutions, isn't it, that we need to focus on. Not what happened yesterday, not what's happening now through COVID, but what we're going to do tomorrow. And that's really, really important that we focus on those solutions. I'm glad to hear that we're having a review and that you're looking into this. But I think the main thing is that we need to make sure that we engage with the people. We hear the voice of the people. We hear the story in order then to address it properly. Because without that, it's not real for the people. The fact is, I would like to see some emergency provision brought to the island as soon as possible to start directly inputting into addressing the gaps for young people, for children and for families generally, right across the island. I'm not drawing any distinctions here between where, but we need an emergency response in my view now. We need to see that, and I'm very grateful that Bob is actually in the meeting, because if there's anything that he can do to push through an emergency response for us on the island, particularly in those areas of high deprivation that we have, that we hit areas running now. We can wait 6 months, but my teeth or other people's teeth can't, can they? So let's not wait. Let's look at what we can do tomorrow, the day after, in 6 months, and in 12 months, in a year. And that includes all of the things that people have talked about here: recruiting, Bob working in government, us working here and now, doing the needs assessment as quickly as possible, but making sure that we reach the people. So I'd like you to define who you intend to do that needs assessment with in the wider context. The public health team can help with all of those messages, and we've got them here today. Fluidisation is an interesting one that's been brought up, and it's been done in some other areas. There are pros and cons to that, but we've got some learning that we can look at in the past. So really, let's stop talking about the problem and let's focus in on the solutions. And that's what I'd really like to see from you, Alison, is a list of solutions we're going to do, A, in the short term, B, in the mid-term, and C, in the long term, all with high, low, minimum and no-cost solutions. Thank you.
Thank you, Carl. Alison, can we ask you to report back to us with progress for the November meeting in 3 months' time, and if anything moves in between, we can have another informal briefing with you?
Yep, that's absolutely fine.
And you've heard a very loud and clear message, I think, from all quarters here. And I see there was somebody, who was a member of the public, had his hand up. What's his name?
No, Alex Lilly is Bob Seeley.
Oh, right. Oh, okay.
Yeah, Alex is my.
Alex is one of your aliases, Bob.
Yeah, we've got you in stereo, John. It's wonderful.
Yeah. Did you still get your hand up, Bob? Is there anything else you wanted to add to that? Or?
Sorry, it's coming down.
No. Okay. Thank you very much. Okay. Well, we'll move on to the next item in that case, and that is update on COVID. So I think we're over to Simon.
Many thanks, Chair. So just this is to give the committee an update on where we are with COVID statistics and a few other updates. So we're seeing that our rates have fluctuated in many age groups. However, we have seen an increase in all ages. So our 7-day rate, so just to remind people, that's the number of new cases, and the rate per 100,000 is 331. And our rate of over 60s is now 124. So rates are still highest in that 15 to 19-year-old, and we are seeing that kind of steadily going up. That is expected as society's opened up, and we've seen those cases down as schools have gone back, so we've been looking at that. The good news is, with 80% of our population vaccinated, that is not in the main turning into serious disease. However, we are seeing some hospitalizations through the population. But in the main, the vaccine is breaking that chain between infection and hospitalizations, but not completely, in working with hospital and other colleagues. So we've continued to see that, and we work closely with colleagues around the patch and around the table to make sure we do all we can to prevent spread, manage any outbreaks, and further look at the cases. It's community spread. We're not seeing any particular places or areas, but that is because, as I said, we are mixing more and schools are going back. If I just move on to a couple of other items, which would be helpful. So, bearing in mind we've got the festival this weekend, we are unsure of the impact the festival will have on local community transmission and case rates. We're looking very closely at other events, and we know that Victoria's Festival, which has a similar demographic to the Isle of Wight Festival, there is currently no evidence of a spike in rates from that, but we are looking at that very closely going forward. Vaccination and testing continues to be absolutely vital to prevent spread of this virus and to protect our population. We're working very hard with NHS colleagues on both those areas and doing very well to increase that uptake. Doing an awful lot of comms messages ahead of the festival and continuing that to ensure people do test. Do think about how they're meeting and thinking about other measures they can take to prevent spread. I think, Chair, it's probably easy if I pause and take questions.
Thank you, Simon. Have we got any questions? Councillor Mosdell.
Hello, Simon. How are you? My question is, do you think there might be an unfair bias towards the Isle of Wight Festival? I did Walk the Wight yesterday. There were loads of people at Walk the Wight. Everybody was suitably careful, but I didn't hear anybody saying, let's not do Walk the Wight. Wolverton Fete happened recently. It was really, really well attended. And nobody said stop Wolverton Fete and things like that. I know the festival's huge and you're talking a large group of numbers, but actually lots of people are outside, aren't they? So do you think that we should be doing more of an onus that actually on all events we should be more careful and not just singling out the Isle of Wight Festival?
Councillor Mosdell, absolutely right. We need to be really mindful of all of our activities in the community. Obviously, the Isle of Wight Festival is a large event. We work really closely with the organisers to make it as COVID secure as possible, thinking about ensuring people are tested. Vaccination, we're going to put a vaccination pop-up now. That won't prevent spread, but it helps, and a number of other things. In line with the government's guidance, we've opened up society quite rightly, so we need to work within that guidance and make sure that things are as safe as possible. As you say, alongside other events that are going on, we have a safety advisory group within the council and with partners, and we work really closely with event organisers to ensure that events are as safe as possible.
Thank you, Simon. Now I'm just looking at Darren from the Trust and Alison from the CCG. Is there anything that you wish to update us on the COVID situation from your perspective? I see Alan has got a hand up like a shot of lightning.
As you would expect me to, John. I think the positive news is that alongside phase 1 and 2 of the COVID vaccination, we're now prepared and ready to do the booster vaccination as soon as we get the absolute guidance and also vaccine comes over. And we're using a mixed methodology of primary care doing the bulk of the vaccinations as they have done in phase 1 and 2, with the Riverside Centre continuing to stay functional and also with the hospital offering vaccines to their staff. So repeating the success of the initial vaccination programme to do the booster, and we would encourage everybody to come forward for that vaccination when they're asked. Thank you, John.
Thank you, Alison. I see we've got Steve Parker, Medical Director. Steve?
Yeah, thank you, John. I've agreed with Darren that I would respond on behalf of the Trust. I think following on from Simon's comments, we have seen a rise in the number of COVID cases over the last month or so. They are no way as high as they were in wave 1 or wave 2. The numbers have reflected with an increase of the number of patients requiring critical care. And I think the current COVID situation just needs to be placed in the context of what the overall health service is experiencing. We clearly are experiencing quite significant demands on the front door of our hospital. We are expected to continue to our elective recovery programme, clearly with a large number of patients who have been waiting a long time for their treatment during the pandemic. And therefore, I think if you put all three things together, it is building up to a degree of pressure on the Trust that this time is not simply all COVID. If we were having this conversation during wave 1 and wave 2, we would be simply talking about COVID because that was the main thing that we were dealing with. But clearly, we are trying to deal with other pressures across the organisation and will continue to do so for the inhabitants of the island.
Thank you very much, Steve. So I've got Councillor Lucioni and Councillor Mosdell.
Hello, Simon. This is something that's slightly more practical, I think. But lateral flow tests, how effective are they day one of a infection, for example? So for the festival, will you be giving them out of ferries to people, etc.? So I never know. So I work in care, so I do at least 3 a week. But I never know. So I've just come back from Dublin. I've had a negative one, but I never quite know from infection to what day that they're good.
So you're right, lateral flow tests are a good screen. They don't say if you've got COVID or not, which is why I ask people to take them regularly. So with regard to your point about infectivity, the more infectious you are, the more likely to be positive during that phase. So with regards to advice for the festival, we have asked people coming to take them before they come. If that doesn't happen for whatever reason, we've got people at the ferries on the mainland. We've got extra testing sites on the mainland, and we both at mainly Southampton and Portsmouth, but also Lymington, so that actually we can encourage people to take tests. If, however, they get to the island and still haven't had a test, we have increased our pharmacy offer to ensure that people can get a test. So basically, we are at every point ensuring that people can access a test. So not getting a test isn't really going to be a problem. We've really done that. And we're also encouraging people to test after they've been to the festival, because as you say, if you've been somewhere, and that will really help us to prevent spread. And that's what we need to do both on the island and those people going back to the mainland.
Simon, Councillor Mosdell.
Yeah, I've got 2 questions. One probably is an expansion on that, please, Simon, from you, which is how do you feel about the reliability of the lateral flow tests? I had a friend who took 3 lateral flow tests. He was a man, so, you know, we didn't know if he was ill or not, really. But after lots of days of whining and lots of lateral flow tests, test came back and they did actually have COVID, but they had taken 3 lateral flow tests. So I don't know if you've got any data on how reliable those tests are. And then I have a question for Alison. Alison, could you just explain the process of if the booster is coming in for COVID, how does that work with the flu jab? Do you walk into the vaccination centre and have a double whammy, or is there a gap that has to be between flu and the COVID? Because it would be good for the general public to actually have some level of understanding of that, because we all hear sort of people saying this and saying that, but it will be good to hear from yourself. Thank you.
Shall I start? Is that okay? Thank you, Councillor Mosdell. So you're right, lateral flow tests are not as accurate as a PCR test, which is why we are using them for asymptomatic people. If someone has symptoms, they should get a PCR test, because that's what it's for. And I think people are kind of thinking, well, I've got a lateral flow at home, I can do that. And that's not correct. They are like a screen, like any other screen you might have to see if you may have it. And obviously they're not 100% accurate. So if you have symptoms, you need to isolate, take a PCR test, and then find out if you're positive or negative. But the lateral flow is helpful for asymptomatic people who may be carrying it, and doing that on a regular basis, as Councillor Lilly has said, she takes it regularly. That's what we should be doing as we're going out and about.
Right. Councillor Lilly and Councillor.
Shall I?
Yeah, Alison, yeah.
I can see Michelle's got her hand up, so I'm assuming that Michelle, you're going to answer that question on our behalf. Michelle.
Thanks,
Michelle.
Alison. Hello, everybody. Can you hear me all right?
Certainly can.
Lovely. Hi. What we're doing with respect to flu and COVID is that we're just starting and getting cracking on flu. So many of the practices have already started their flu vaccination. I was actually yesterday, Sunday morning, vaccinating at Tower House Surgery and did 5 hours worth. So we're racing ahead with the flu. I think it's very important that we wait for advice from the government, because presently we're still waiting for absolute clarification of exactly when we're going to start the booster programme and which age groups will be in that booster programme. And we're waiting for official advice about length of time between COVID and flu. But my advice would be to anybody worrying about that is just to go ahead and get your flu vaccine if you've been invited by your GP surgery and or at a chemist, if you're in a high risk group, and that's anyone now over 50, and or in a high risk group. Just go ahead and get your flu done, and don't wait to have both done at the same time, because I think it's much better just to get protected as soon as possible against flu. And then as soon as we know what we're doing about COVID, you'll be invited by your practice or you'll go to the Riverside, depending on which groups are invited forward for the COVID booster vaccine.
Thank you, Michelle. So now we've got Councillor Lilly and Councillor Downer.
Thank you. I wanted Simon to come press on the back of what you've said. I think it's very important. I think Councillor Mosdale made a good point. We get very focused on the big events, but actually we're opening up, and it's you know, people having, you know, like councillors' ward meetings. There are a lot more kind of community meetings that are now happening. You know, church, you know, halls and community centres are opening up. And I think probably a number of us here know of a number of public meetings, issues, you know, like planning and things that are coming up. People suddenly want to get out and get their views. And I'm actually more concerned about those local events than the big events, which are, you know, can be very focused of that we do encourage people to do the tests and actually put out to, you know, to councillors, to parish town councils, all the organisations, voluntary sector organisations, to be very aware of what we still need to do of hands and face. And I think we do need to have some kind of programme within the autumn, because you are going to have a lot more of these kinds of events. I myself are probably, you know, going to a lot more things in the last couple of weeks than I have been for, you know, the last year. And it's more of those kinds of events that I think actually we could have problems than necessarily the you know, the big kind of ones, because if people come over here, they're tending to go to an event and then they go back. Within that, it's what we do in our communities, which I think we do need to have.
Thank you, Michael. Good point.
Yeah, Councillor Lilly, you're absolutely right, and how we kind of think about those events in a different way as we come to autumn. It's not quite so pleasant meeting outside anymore. So how do we kind of move forward in that way and think about how to make them as COVID safe as possible? I'm absolutely not about stopping events, just thinking about what we can do. Let's have hand sanitizer around and those things. So we can do some work with our comms teams to make sure those messages go out to all relevant organisations. And also on those media channels that we may not see for other people who enjoy different types of social media like Snapchat and other things. So doing that so that everyone's catered for.
Thank you. Councillor Downer.
Oh, thank you, Chairman. Just like to ask, when it comes to the COVID booster and who's going to have it, is it going to be the opposite vaccine to what they had the first time?
I'll hand over to Michelle Legg for that one. I think we're still waiting for guidance on that, which will come from the Chief Medical Officer and the Joint Committee on Vaccinations, Immunisations. They're nodding. So we're just waiting for that guidance, which is what I've said earlier.
Right, so that's COVID updated on. We're going to have a slight agenda switch now because I think Simon has to get off. So we're going to take item 8, health in coastal communities, first. Now, this is a very interesting report issued by the Chief Medical Officer, and it has some very interesting and revealing factors on the health of coastal communities. And I think, Councillor Lilly, did you want to make some comments on this?
Well, I think firstly, Chair, I'd just like to welcome it. I think a lot of the issues that it's raised within coastal communities are actually reality on the island. And I think that we should actually welcome this report because it does highlight our health inequalities. in a way you could see this report actually backs up a lot of the things that we've actually said in the past. And I think we should be, with our health partners, using this report to argue, if we've got our MP still there, but actually arguing about the resources that are actually needed on the island regarding our issues. And I think I would just like to, once people have discussed it, propose that we support the recommendations that come out, which I think they're important recommendations. It's not often we get a report that absolutely supports the things that we're saying, so I think we should fully, I will be proposing that we actually do accept those recommendations, which are actually in detail, as a scrutiny committee, and we do ask our MP and you know, the various other channels to use this report to highlight the issues. You know, it raises the problems of housing, which is a big issue. You know, Maslow's hierarchy of need. We need housing for people in need. If they have health inequalities, then they need a roof over their heads. That's the side, and it clearly says that. Clearly puts the issues of the economy and employment within this, the needs of the health services, the medical workforce, a lot of the actual issues, you know, mental health, you know, clearly within this. A particular point I would like to make, I think it's important that we start talking to other coastal communities about their issues. You know, if you take Hastings, South East, has very high issues about regarding mental health and that. And I think we should start talking. It's very interesting under historic England, completely different subject, our historic high streets, but we're already talking to Folkestone and Ramsgate and doing joint kind of projects. Can we do that in partnership with other things? And I'll put in a question. There is still a funding stream called Coastal Communities, and that is still there. There are still in the government coastal community teams. There's still, I'm not sure, there was a minister for coastal communities, but we should actually be going to that source of funding and saying, here we've got, you know, Professor Whitty's report saying that, you know, we've got a problem. Yes, we have. We need more resources and money. Can we get it through the coastal communities teams within that? So thank you.
Thank you, Michael. So we have a question and a proposal. Simon, did you want to say something?
So, Councillor Lilly, really, really helpful. I absolutely agree. It's a really helpful report. I think just a couple of things I want to add to that. One is we do our own joint strategic needs assessment. We'll be using some of the information in here to help drive that. So we really understand for the island what are the island issues alongside this. The recommendations in the report are for national because it's a national report, but I absolutely support that and we'd make ours local. As if you are reading my mind, I'm now, as soon as it came out, we have a Southeast group of Directors of Public Health who are meeting to talk about how we take forward some of the work around coastal communities and learn from each other, such as my colleague in Hastings. So that hasn't actually met yet because it's just timing, but that's in the next month. Really happy to bring that forward, probably to the Health and Wellbeing Board locally to start to share that. But our joint strategic needs assessment will bring those issues out. And as you say, it's a really helpful report to help us think, as you say, what other coastal issues there are and how we drive that forward. So yeah, absolutely welcome it, and we'll make sure we feed that into our local reports.
Thank you, Simon. Councillor Mosdell.
Sorry, I do apologise. It's because I've got not much to do anymore, so I spend ages reading all these reports and everything. So, I just want some assurance from Simon. Further recommendations 4.1 on page 43, or page 24 on our report, I'm doing on mine off my computer, it says, continue work to ensure directors of public health and every integrated care system, ICS, are an integral part of the ICS executive leadership team board. Could you just clarify for me that you are actually very much an integral part of that team? Because I do think that's really, really important that you have such a strong voice for the local authority within that group.
Yeah, thank you, Councillor Moore. Absolutely. So work very closely with the integrated care system, which covers Hampshire and Isle of Wight and the local ICP. I'm the kind of main lead director there, partly because of the role I have across Hampshire and Isle of Wight, so I cover a large geography. So for me, the benefit is the island issues are not forgotten in that space. They're just formalising the leadership of the ICS, as colleagues would say, so I will be building in that, and we have very good relationships. I speak to the executives on a regular basis and part of key groups there. And as that forms further, public health will be a key part of that organisation.
Thank you very much. So we had a proposal, but I think it's quite clear that the Director of Public Health is already on the case. So thank you very much for that. Now we go to... Sorry?
Can we have a vote on our...
Right, fine. We'll formalise it, Michael. Right. So the Vice Chairman has proposed that we support the proposals, the recommendations in this report. I'm very happy to second that proposal, and we'll take a vote. Committee members, those for, please raise your hands. It's unanimous as expected. So thank you very much. Formalised. Right. So we now turn to item 7 on the agenda, which is the latest GP patient survey. Alison, do you want to lead on this?
Yeah, happy to, John, thank you. I'm just going to pull out a few of the details from this report, which I hope colleagues have had an opportunity to read. As you can see, this was for the whole of Hampshire, Southampton and the Isle of Wight as one partnership CCG. We were included within that. There are some positives in here, and there was a response rate of 44%, which is an excellent response rate for this type of thing. And as you can see from the results headlines, 50% of the questions were asked. We were above the national average, which is really important. And on 3 of the remaining questions, we were on par with the national average, but there clearly is some more work to be done. As you can see from the results where it talks about how many people have said they were given a time for their appointment, their mental health needs were recognised and understood, what their overall experience is like. All of those are incredibly good standards to achieve in terms of 91% given a time for their appointment, 88% said their mental health needs were recognised and understood, and that 83% said their overall experience was very positive. Further down, you can see that 2,000 people found it easy getting through to their GPs, that's 67%, and the list goes on. I don't want to really read them because they're there for you to see. There's some key headlines in there about same-day access and general appointments, how much the demand has risen, and it talks here about risen to pre-pandemic levels. And I can tell you that the latest data we've got from the island's primary care offer was it was in fact 12.6% above the pre-pandemic levels. So huge demand going through primary care, as Steve was sharing, similar story for the trust as well. In the midst of all of that, having delivered 80% of vaccinations on the island, 75% of those were done by primary care. So again, significant flow through in terms of work and efficiency for primary care. And the list goes on in that it tells you about the mixed offer within primary care now, with social prescribers, with paramedics and also physiotherapists. And clearly we've always had practice nurses, but their remit is doing more and more. So you have much more of a multidisciplinary team within primary care. There's also a section in there about communication strategy. And if you recall, That was a previous question at HOSC about a communication strategy, about how primary care is managing in the face of continued infection prevention control as we live with COVID, and that continues for all healthcare environments, but also about the flu vaccination programme, how you're going to get COVID, and many of the other schemes that primary care do to keep us safe and to keep us as well as possible. We have put some specific island information in here, which I think would be useful just to talk about. We've talked here previously about some of the access issues for Cowes Medical Centre, and they've now installed their new telephone system. We're getting very positive results from that. That the increase in the e-consult offer that's used by patients is standing at about 1,000% for increase for island communities, and some find that very helpful. I can share with you, though it's not here, that the latest data I saw, that still 67% of our people are still being seen face to face through primary care. So again, very good that we're getting a mixed offer for those who want to visit primary care. It does talk about that there's been successful recruitment, as I just said, but specifically for the island on social prescribers, paramedic, health and wellbeing coaches, occupational therapist, and musculoskeletal first contact practitioners. So really good effort in terms of getting a mixed offer to be seen at in primary care across the board, accepting that some of the recruitment issues we've been hearing about earlier today from dentistry. We still experience some of those with GPs, but we are getting a much better response from other professional groups that support GP practices nowadays. On top of that, we've moved some more services closer to home. So the phlebotomy services that were moved from St Mary's Hospital into primary care has now been fully embedded, and blood pressure monitoring schemes are underway alongside a pilot tissue viability service that's in the south of the island that's getting the initial responses we're seeing is very positive. So we're looking to see that pilot complete, to do the evaluation and talk about which area we go to next, alongside some of the support that's been put in place specifically for COVID around COVID oximetry at home, long COVID service, and a weight management enhanced service underway. So clearly a lot has been done. It doesn't mean we stop on our and we don't continue to keep working in the way that we have, supporting our primary care offers across the island and supporting what they're trying to do. But just asking, if there's any questions from that, John, because there's quite a lot of information in there.
Thank you very much. I have Councillor Mosdell and Joanna Smith next.
Thank you, Alison. Mine's a bit of a thank you, really. I recently used the NHS app to contact my local medical centre and used eConsult, and I thought the service was absolutely brilliant for someone like me to actually hear the next day, have really good feedback. Since then, I've ended up with a hospital appointment. Everything has gone really, really well via eConsult. And actually, I don't want to hang on the phone at 8:30 in the morning trying to get hold of, the GP's receptionist, which I always used to have to do, and that absolute frustration of waiting for everybody else to ring. There is that 8:30 on a Monday morning deadline, isn't it, that everybody's got to read the GP's. I've got a couple of friends who are GPs, and I feel their frustration. So it is a really, really good service, but I don't think we actually sell that service enough. So my husband has quite a difficult heart issue, and he didn't realise that he could order his prescriptions online off this app and stuff like that. He's the same age as me, but he took some convincing that it wasn't actually the devil on his phone. So I do think we do actually need to push that service more. I think people like my mum, I said to everyone here earlier, it's amazing. She can order a pair of shoes on the internet, but she can't actually manage to do eConsult. I'm not quite sure where the difference is really. Maybe she needs shoes more than she needs the doctor. I'm not quite sure on that one. But how can we push that service more and take the fear away from people that actually it isn't complicated, and actually it is a lot healthier for you if you can manage not to see your GP face to face. I just wondered how we could just push that slightly more. I do get it's not right for everyone, and Alison and I completely agree on that. There's horses for courses, aren't there? But for people like myself, you know, we really should be trying to get people to use that service more. How do we do that?
Thank you, Claire. Two comments from me. We've seen 1,000% increase in the people who do use e-consult, so people are getting that message, but we need to do more. The communication strategy that we talked about that's going to come out, I think will do exactly what you've described, Claire, because it will say, you know, what works well, how best to access your practice, and we will get that out as soon as that's been completed, Claire. But also word of mouth, you know, telling people how good it is, your really positive stories, and thank you for that, will really help people to step forward and give it a go. And once they've given it a go and they realise that it is just like ordering your shoes or your shopping, then hopefully they will realise how easy it is. So thank you for your kind comments.
Sorry, maybe in that part of that communication strategy, there is nothing like doing little runs of little videos and things like that. So it might be an idea to actually have some of those run, or maybe on Isle of Wight Radio or something, part of that communication strategy, because people don't tend to read things in printed word half the time. It is that this is a little video of how it does work, and these are people's experience, seem to communicate better with the general public. Thank you.
Yeah, great idea, thank you.
Joanna.
Thank you. I just wanted to mention the work that we're doing at Healthwatch. So we've started a piece of work in partnership with other local Healthwatch across the south. So we're working with Healthwatch Wiltshire, Hampshire, West Sussex, amongst others, purely looking at access to GP services. So we've been working primarily with GP practices to start with, understanding the situation from their point of view. And we heard from one practice manager a couple of weeks ago who said that his practice had 700 telephone calls within 30 minutes on Monday morning. So I wasn't aware of the sheer volume of calls that practices get. So I think there's some work again to let the public know about the volume of calls that practices are getting and the actual number of people they are actually seeing, because it did surprise me. We're also looking at ideas that practice staff have to make it easier for patients to get access to the practice. So that's a really positive piece of work. But possibly the most important thing is for GP practices to hear about people's experiences. So to hear from the people that do struggle to have access for whatever reason. And because there are still a lot of people that are struggling to have access, particularly people with a mental health problem, some older people, those without internet, you know, people that can't afford perhaps a smartphone. So again, there are two sides to this. So it's putting things in context and understanding the pressures that GP practices are under, but it's also looking at the experiences that the public are having. Some are having good experiences with their practices, others are not having so good an experience. So we need to look at what the good practices are doing and share that good practice to make sure it's equitable across the island so that everyone gets a good service from their GP, not just a few.
Thank you, Joanne. If I may, I think there's a couple of points I'd like to raise from that. This survey is completed by the general public, so it's a really good source of information, but I absolutely accept the work you're doing with Healthwatch will give us another level of information, Joe. So thank you for doing that work, and we look forward to seeing the outputs of that. In addition, I think one of the areas you've mentioned, the large number of volume of calls that can happen first thing in the morning. We also still get a large number of people who do not attend their appointments. And we would just urge people, if they're unable to attend, if they could just contact the practice either by e-consult or by phone and just say they're unable to attend. That does release that appointment for other people, which is incredibly important as we go forward. And it's also worth noting that CQC still have a good rating for all of the practices on the island. So the services getting to your GP are good, but I do accept there are some access issues when we've got such high demand that you've described there, and we are aware of some of those challenges. So we just need to keep doing working together to try and make sure that equitable access is available for all, and that we maintain open lines of communication about how best to get in contact with your GP if you are able to access the internet, if you are internet savvy, if you are able to use e-consult, please do, because the return calls work very well for most people and they fit well, and therefore those who don't have smartphones or are unable to use the internet for whatever reason or choose not to, that they are able to access their GP by phone. Very important to use a mixed methodology here. So thank you very much for that.
It seems, Alison, that there's very good grounds for local surgeries to have a dialogue with their ward councillors and town and parish councils, because I think a lot of the issues that GPs share, like 700 phone calls before 8:30, I think people wouldn't understand and wouldn't readily appreciate, nor would they appreciate the consequence of them missing an appointment. And it's not just them, it's a lot of people missing appointment, but also it gives that opportunity for feedback, good and bad. So I'd like to encourage local practices to embark on a simple form of dialogue with ward councillors, town and parish councils. I think Councillor Lilly wanted to say something now.
I just come on the back of that, Chair. I think that surgeries are part of the community, and it's actually getting that linking into within that community, because some of the solutions are not with the GP, it's actually with the community. And I think there's a very good example, and I'll use the Tower surgery, if you may, Michelle. But I mean, recently, Rye Town Council gave a grant to a group of men who set up a group called Men Only, which is to help men that are isolated to get out, meet others within that. And that was linked to the social prescribers at the local surgeries. And I actually went on the first walk and talk, and actually 20 men who were referred by those surgeries with those social prescribers actually met up with peers. And it was an incredible day of seeing people feel they had someone. And that was a very good example of a town and parish council working linked to the social prescribers and the community themselves coming up with a solution. And I just think that we should be encouraging that right across the island through that. And it'd be really good to get examples of that. So I just really wanted to come on the back of what you said, Chair. Thank you.
I can see Michelle nodding and smiling. So it sounds a great initiative.
Thank you very much. Now, Councillor Love, Cabinet Member.
Thank you very much for your report. I'm just kind of looking down the reports themselves, and I'm very interested in the research methods, really, to be honest, because I think if I've got this right, you started off by saying that we had a 44% respondent. Is that correct? That's the first thing to say. But that's across Hampshire and Wight, and really, I'm really interested in, as the local, ward member, what's actually happening here on the island, rather than so of that 40%, 44%. There's no definition of how that works out in reality for the island, how many people responded in the island. So whilst these figures are all quite interesting here, if it's only 6 people that have responded, to a particular question, it doesn't make any sense. So we need more data specific to the island, if possible. So therefore, we can then target in and make sure that responding to that. So, you started off by saying it is a report for Hampshire and Wight and GP surveys, whereas I would really like to see all of the data presented in this way with the island specifics. Yeah, this is per practice, but that doesn't tell me how many respondents there are. This is 90% of the respondents, which could be 5 for all I know. So and that's what I'm saying is it's about the data research that matters, because I can make figures look like wonderful things if that, and I'm not criticising you, I'm just saying that the figures need to be more drilled down into.
You want tangibility. Thank you, Carl. One of the items that the Scrutiny Committee were going to take up before the advent of COVID was to organise an informal meeting with PPG groups, and I think we'd like to resurrect that, Alison. Are PPG groups reformed now or reforming? Do we have a date when they should be reformed?
Yeah, as you're aware, John, they were stood down over the COVID period, and they're now in the process of being rebuilt back up. So they're not fully formed as yet. Some will be, some won't be. But I completely agree that getting those set up is of vital importance for good community links in with practices, and for practices to hear how their registrants are feeling and understanding the services and listening to the recommendations, what's gone well and what hasn't gone well. So I completely agree, those are a critical piece. But I can see Michelle has put a hand up, so if you don't mind, I'll pass over to Michelle now.
Thank you, Alison. PPG groups have been absolutely essential to primary care, and our PPG group at Tower House was absolutely essential and vital for when we became an age-friendly practice and a dementia-friendly practice, and we used our PPG group to form a template on how they felt the practice should be age-friendly. But just a slight word of caution, our PPG group wanted everything to be face-to-face. Some people weren't even on the phone, so we always had to write to them to invite them to the meetings. And presently, we have to be mindful of face-to-face meetings with COVID. So there is a slight tension in wanting to get it back together. But I feel, and I do feel for our PPG group, it's essential that it would be face-to-face to get that proper feedback and that proper engagement from our patients. So we have to sort of mind that with balance it with you know, the COVID at the moment as well, bearing in mind that we're getting, you know, we do have high rates on the island. So I'm an absolute advocate for PPG groups, and look forward to when they are fully back functioning.
Perhaps when they do start to reform, there might be a place for local town and parish councils to have representation on there. Is that possible?
I think if they were a patient at the surgery, that would probably be even better. But there's no reason why they can't come and engage as a guest to the meetings, and I think that would be very successful. But obviously, it is a patient group. So obviously, if we were lucky enough to have a counsellor as well as a patient, then that would be perfect. But otherwise, they're more than welcome to come as a guest.
Thank you. So I've got Councillor Lucioni and I've got Councillor Love, which is to come back in.
Hello, Michelle. It's Karen Lucioni here. I'm your ward councillor for the Isle of Wight Council on Town, and I'm a patient too, so I'll come and see you.
Perfect. I will make sure that you're invited when we get going.
Thank you. So sorry to drill down again, but just do want to drill down. Could we have a report that comes to this meeting, although I'm not actually a part of the committee, that tells us how many people participated in this survey from the island, and to try and quantify these figures here, you know, so pick the Cowes Medical Centre, how many people actually participated from Cowes Medical Centre, because then that gives me a precision about how people are responding and gives me more data. I think that's much more helpful because, you know, if you're telling me that 100 people have responded from each of these centres, then I feel quite positive about it. But if it's only 10 and I don't know how many people have responded, that's quite worrying.
Is that possible, Alison?
I'm not sure it is, because as a CCG, these get sent out to our patients anonymously and are responded anonymously. But I will certainly ask the question, Carl, and I'll come back to you directly via John on the whether that is able to be done or not, if that's okay. I'll find out.
I think it's a good point. It would would give validity to the extra validity to the questions. Now we've got.
Chair, may I just say thank you for that. I think it's really important because we don't understand at the moment. That confuses me even more about if we don't know how many people have responded to each of those questions. How can you quantify those centres to start with? So somebody's got the information. Otherwise, you couldn't say East Cowes Medical Centre has 44%. It's really important. Thank you.
Right, we've got a maiden speech here from Councillor Robertson.
Thank you, Chair, and thank you for building me up. My maiden speech is just simply to agree with Councillor Love on what he's saying about statistics. How do we know these percentages are statistically significant if we haven't got access to the raw data? And just because the responses were anonymous, again, that shouldn't mean that we can't have total figures for who responded to these various questions, where at the moment we've got percentages. Obviously, percentages are useful, but even more useful in conjunction with absolute figures.
Thank you very much for that. So we'll set up an informal meeting with the PPGs when they're back, and we'll talk to you about that. Right. So item 9, integration and innovation, working together to improve health and social care for all. Now, I guess this is Alison.
John, I'm really pleased to say that Paul Gray is with us today. Paul, do you want to introduce yourself?
Thank you very much, Alison, and thank you. It's good to meet you all. I'm Paul Gray. I'm one of the directors in the CCG, and I'm also now the lead for the integrated care system development. I know many of you have met Richard Samuel, who came along to the committee at its last meeting. Richard's now moved on to a national role, and I've taken his responsibility from the beginning of September. So it's good to meet you all and to talk about this. I'm just going to say a couple of words by way of introduction. I'm not going to go through the detail that's in the paper, and happy to answer any questions. And I'll also, I know that Darren and Alison, Steve and Michelle will help me with any questions, because this is really all about how we're working together. The Health and Care Bill is making its way through Parliament, as you know, and Health and Care Bill helps us to put on a statutory footing the way that NHS organisations and NHS organisations working with local authorities operate and can operate in future. And all the paper really does is give us a bit of an update on that statutory process and the structural change, and hopefully some of the detail in there is clear, but we can pick that up. I just wanted to say 2 things which I hope are helpful as we look at this. So the first one is that front and centre in all of our minds is, how do these structural changes make a difference for residents in general, and specifically for residents on the Isle of Wight. And I think that there's 2 things that give me hope and optimism in this. So the first is that what the Health and Care Bill does is it takes away the fundamental basis on which the NHS has been working as if healthcare is a market that we've operated in for the last couple of decades, and it puts collaboration and partnership working as the basis, the first and foremost basis of the way that we work together. And I think that is important for people who live on the Isle of Wight, where we rely on bits of the NHS being able to be joined up so that individuals experience joined up care. And we know how important it is for your partners on the mainland to be able to reach in and provide expertise so that we can sustain services on the Isle of Wight. So I think taking some of those things that have got in the way of collaboration, some of the legal barriers that have prevented bits of the NHS working together, is good news and can translate on the ground into practical differences for individuals. And the second thing that I want to say, which gives me optimism, is that at the heart of the Health and Care Bill is about how we work locally. And so we've got an integrated care partnership on the Isle of Wight that brings the trust, primary care, the CCG and a council together. And that's at the heart of what these new arrangements are about, and it's about strengthening that, building on that at the pace that we want to, and certainly absolutely not about unpicking any of that. So hopefully we can also add to that with the benefit of bringing the input and expertise and advice from other providers in other parts of the NHS on the mainland. So happy to answer specific parts.
We've got Councillor Mosdell. Thank you for that.
I'm really sorry about this. You probably don't realise I was doing quite a lot of this for the last 4 years. So for me, I've got a bit of a question and a bit of a wonder, really. So I really want to know is how big a part has the local authority got in the governance of the ICS? Because social care and the local authority just always seems to get treated like the second-class citizens. We have the perfect example at the moment that we are having an increase in national insurance, which, having read probably every white paper and King's Fund report that's been produced in the last 11 years, because I'm a bit of a geek, everybody knows that, the funding for social care is a huge national crisis. I think some of us felt quite excited that actually there was some form of solution, even if it was in a form of national insurance taxation, that would actually help resolve this problem. As a local authority, we have to make a huge amount of savings, and we have a social care system that's on its knees, but actually that money is now going to the NHS for the next 3 years. So I'm sat at this table listening and reading a document about integrated care systems, and I understand it because I've been sat at that table for a long time. But actually the most important thing for all of us is the money, and it is a case of how are we going to help the social care system on the island and help our director over there, Laura, be able to fund services, when actually for 3 years she isn't going to have any help with that whatsoever, because it will be going to the NHS to reduce waiting lists. So how big a part are we really seriously going to be playing in the next 3 years, and what are you going to be doing in return to help us with what is a serious crisis within this local authority and across the country? Thank you.
Thank you, Gary. You were able to respond to that?
Yeah, yes, and welcome those points and the chance to talk about this. So I think the top table of the ICS is this body that's described in the document as the Integrated Care Partnership. I know we talk about the Integrated Care Partnership on the Isle of Wight, and some of the language has changed in the national document, but the top table of the Integrated Care Partnership is absolutely a joint initiative between the 4 local authorities and the NHS. So its minimum membership around the table is 1 person from the NHS and 1 person from each of the 4 local authorities. So I think that does start to give us, it absolutely gives local authorities a seat and a voice at the top table. Perhaps the even more important thing is how we actually work together across Hampshire and Isle of Wight, and we want to further strengthen and join up the way we work, because there isn't a way to integrate care without doing it jointly across health and social care. On the Isle of Wight, we can mirror that governance arrangement that's described at the scale of Hampshire and Isle of Wight, with yes, a way for the NHS to join up what it does on the Isle of Wight, but with a strong voice and absolute membership of the council in the local arrangements that we develop on the island, so that we can together join up what we do for island residents.
Councillor Love, Cabinet Member.
Thank you. I'm sitting here feeling a bit dismayed, to be honest, because so far nobody's talked to me about integrated care systems at all. And you've appointed somebody to chair, and there's been no discussion with us whatsoever on that particular issue. And so we are a bit standing off at the moment, because there isn't any significant conversations going on that I can see with me or my teams here. I want to thank Councillor Mosdale, because she has got a lot of experience in this, and I really appreciate that. We are in a difficult position on the island. We are not going to be getting any more money. If the front door of the NHS speeds up, our systems in adult social care will collapse unless we have more funding, because we are the people who deal with the aftercare out in the community. And no money has been given to us, and we still face significant cuts from government next year across all of our budgets. So it's really important that we have discussions about this integrated care system. We've had an initial meeting with Mr. Metcalfe and myself about integrated care systems, but at this moment, I'll be honest, I'm reluctant because no one's talking to us about it directly. And it is really important that we all work together, you know, and I don't take away any of the good work which has already taken place. It's really important is that good work and that we all work together. But somebody needs to start talking to us and including us, not telling us what's happening, but actually including us. So there's two issues there. One is that I'm very cross about this government announcement of funding. Because it is not going to help us on the island, and we're going to face cuts next year, whether we like it or not, as it stands now. And so we need your support. So we really need to be working really closely together. And it doesn't seem to me at this moment, from my position, who has now got, you know, who's now the portfolio cabinet member responsible, that any conversation of any meaningfulness is going on. So I would want to ask Laura for a few comments, if that's okay.
Laura, are you happy?
Chair, with your permission, yes, I'd be more than happy to contribute to this conversation. I think there are 2 points I'd like to make strongly and firmly, if I may. The first is in relation to the formation of the ICS board, which is a health board bringing our health partners together, where the local authority is asked to be engaged. I believe there are conversations going on in terms of how the local authority will engage with that board, and those conversations are taking place at a relatively high level. With my new appointment, I wouldn't have expected to have been engaged with those to date, but certainly moving forward, I would absolutely expect to be engaged. I'd urge colleagues in our health partners to reflect and to consider the fact that local authorities are unique by their composition, by their political leadership, but most importantly, by the citizens that they represent. No one local authority can speak on behalf of the others. And if a consideration is given to local authority membership at that ICS board level, it must be local authority membership from all composite parts, not simply from the biggest, the loudest, or the highest populated. My second comment relates to the formation of the Isle of Wight Care Partnership, that the level below that ICS Health Board, if you like. And I'm aware that the Chief Executive has prepared a paper that will be coming to Cabinet for consideration in terms of the role the Isle of Wight Council wishes to play in that place-based driver moving forward. I don't feel at this stage it's appropriate for me to make comment. That's a matter for you as our politicians to make decisions around the direction of this authority. As one of your officers, I would be empowered to deliver on your decisions, and that's very much what I'm here to do. I prize and really take pride in the relationships we have with our health partners, and I'm confident that those relationships are strong enough and are sustainable to enable us to have whatever level of robust conversation we need to have moving forward. I truly believe that there is nobody in this room who doesn't place our island residents at the very centre of the development of our ICS and of our ICP moving forward. There's been much comment in relation to the Prime Minister's breaking of a 25-year silence in relation to how adult social care can be funded. And I'd be remiss if I missed the opportunity to highlight that the announcement as it's set out provides no additional funding whatsoever to help this local authority deal with the overwhelming pressures and the increased levels of need that we're experiencing right now. A move to support our health colleagues and specifically the acute trust in dealing with what is inevitably a significant backlog that has detrimental impact on our community is one that I welcome. But what we need to do is make sure that the back door of our hospital is as strong as the front door of our hospital. And whilst we can do and utilise that funding to address the concerns we're seeing in terms of backlog, what we can't do is support people to return home, to build and maintain their independence, and to live the life that they so rightly deserve in our island community if some of that investment doesn't get passported through to social care, be that the local authority, be that our independent providers, or be that, my fondest wish, the people who've gone above and beyond for the last 2 years delivering care and support services to our local residents.
Laura, I could listen to you all night. Absolutely fantastic. I've got Councillor Lucioni and I've got Councillor Lilly.
As you know, I've got a interest in this, so I work in social care, but you've actually answered the question, so thank you. Thank you very much.
Councillor Lilly?
I just think it's incredibly distressing that we have this government announcement, right, from the Conservative government that actually doesn't help us here now. And I think totally support what you said, Laura, and totally support what you said, Councillor Mosdale. I think we need to have a proposal from this meeting to perhaps ask our comments to go to our MP to actually go to the government that although, you know, welcome at least that there's some movement to money for the NHS, it does not help our adult social care crisis, right, now. And actually with an increasing older population that's increasing, coming out of COVID, the reality for us is we're actually faced with cuts, not actually developing, as you say, an effective front door and back door within this. And I think we need to get that message from this committee to our government, and that's through our MP. So I'm proposing that we put our views that have been expressed and obviously minuted tonight to our MP, that he actually then goes direct to the relevant ministers or even the Prime Minister to say, this is not helping the Isle of Wight now in the next 3 years within that. So I look for a seconder in that proposal.
Councillor Mosdale.
I'm happy to second that, but I have a bit of a question. We've heard a lot about, I completely get the ICS and the ICP, but when I was sat in Councillor Love's seat, who we're meant to be scrutinising, he's not a member of this committee, I politely need to add. It's my turn to have a say. You used to all be able to ask me questions. I need to know, so I was a very active member of what we call the local care board. We met sometimes once a fortnight, once a month. I'm really surprised that isn't, it comes across as if that is not happening. You know, even during COVID, we were having extra meetings. You know, I remember sat in my office and having lots of meetings with Alison and Dr. Legg and people like that. So can I have some clarification? Has the local care board meetings stopped, or I'm really surprised there's no involvement from the cabinet member in that.
Alison and Darren have got their hands up.
Darren,
Darren,
I think you had your hand up first. Do you want to go first?
Thanks, Alison. Just to say, I think there is perhaps some confusion, just picking up on Councillor Mosdale's last comment about the continuation of the Health and Care Board. Yes, it is still meeting, and I think as I say, there's been a confusion which we can take offline, and it's still very active. And Councillor Love was actually present at the last meeting or two, I think, from memory. So we can have that conversation offline. That's where we need to get to. I think I had a wider point actually, and trying desperately to avoid the politics. And we have to work together on what we do as we go forward, and we have to put our local residents at the heart of what we do. And we're all here, I totally agree with Laura, to do that. Some way, somehow, we need to find a mechanism to do that. And the creation of the ICS and then the island version of that as a place on the island is absolutely critical in what we do. We can fragment, we can distort, but if we do, we've got less chance of succeeding collectively. And I think that's a really powerful thing for me. It's not as eloquent as Laura, but we have to work together. Both health and care need additional funding. By working together, we've got an opportunity to do that. And both components of health in this meeting would support the meeting's proposal for additional funding to go towards social care as we go forward. It's not one or the other, it's both, and we have to work together.
Thank you, Darren. I was just really concerned that after doing 4 years of lots of work and lots of meetings that it wasn't happening anymore. So I'm really thankful that with your assurance, thank you.
Thanks.
If I may, colleagues, I think there's something else we just really need to hold in mind. We came through the pandemic because we worked together and we delivered for the island community. And we continue to work together and deliver for the island community. And I understand the national direction around the funding is not as we want it. And I absolutely agree, as Darren has suggested, that the way of going forward, utilising Bob and really supporting island funding coming to the island for health and social care is absolutely the right way to go. But I don't want you to go away thinking that on the ground level, directly to our patients, health and social care, with primary care, with the voluntary sector, do not keep doing the good work they started some time ago through the health and care plan that was then taken forward through the pandemic. Everybody works very closely together because that is what our community expect. They expect us to all be working together to make sure that they are given enhanced lives, provided the care they need, whether it's health, physical health, mental health, social care. And we continue to work very, very closely together. And I don't want that to be undermined in any way by discussions about where funding align and governance arrangements, because that is critical for our community to do it once together and really well, to give the best outcomes for the people that we care for collectively. And I just wanted to make that really strong point because our teams work very well together and I don't want them to feel as though that is not going to be the way we continue, because it's essential for the people who live on this island. Thank you.
Thank you for that assurance, Alison.
Councillor Lilly.
Absolutely 100% agree with you that we need that. But I think we also mustn't lose the sight that the reality that our adult social care, when we talk about the budget and next year, actually could be losing services or losing money. And I think we can't, from the local authority point of view, we can't do that. And I think I very much welcome all your support to help us put that forward, that argument that we actually need extra funding now in the next coming years to be able to maintain the services that we had. And I think if we've got a joint voice in that, then that is really important, that we have an island voice that says, through our MP and our mechanisms to government, that we have a particular issue and we need money in the next financial year to be able to maintain, as very eloquently Laura put, the front door and the back door of services, and not the fact that we could be losing the hinges on those doors with the finances that we're actually facing, with the reality of cuts that will, could be have to be made. Thank you.
Can I just add something to that? So that's why I wanted to know that the meetings that were happening regularly were still actually happening, because part of those meetings was that all our finance officers across the system speak to each other. So Darren Cottrell, from Kerry from the local authority, and the Jane Cole from the CCG, they had regular meetings, and part of that ICS process at those regular meetings of every month was a finance update. So everybody would have an update within that meeting of exactly the position the CCG was in, the position of the NHS, and the position of the local authority. So that's why I absolutely needed, as part of this board, to have that assurance, because I'm not part of the bigger picture anymore, that was still happening, and that group finance understanding. We all have to remember that everybody has their own money in their statutory roles, but actually that open discussion on a regular basis, I just wanted that assurance that that was still continuing to happen. And everyone's nodding their heads, so clearly that still does. Thank you.
Laura, sorry.
If I may, Chairman, you've had assurance from the Isle of Wight NHS Trust that that meeting's happening. From the CCG in its new combined form, I'll add my assurance as well from the local authority and from adult social care. I'll go one step further, and it specifically picks up on your question in relation to our finance colleagues. I would like to thank finance colleagues from all three statutory bodies for the hard work, determination, and also innovation that they bring to our conversations. As a team, they work their socks off to maximise our Isle of Wight pound for our Isle of Wight residents, and they continue to deliver day in and day out on every ask we send to them. So I think to commend to the committee the work that the team do, that the work that they do together is really, really important and is absolutely ongoing.
Thank you. So we have a proposal without seconder so far.
In theory, can I second?
Yeah. With a seconder. So we work towards making a representation to our MP from all service sectors, expressing concern at the situation that remains for our adult social care, whilst we appreciate the step that has been made after successive governments dodging the issue for so many years. So can we...
I think we do need to put in that recommendation, though, that we do work as a system, so that our system as this system, the NHS and the CCG actually concur with us, that we need to ensure that, they do not want to see adult social care on its knees. It doesn't help their delayed transfers of care, it doesn't help early prevention, it doesn't happen anything. So I think we need to ensure that we do make the point that it isn't the fault of our island NHS or the CCG, that they all work together to make our island pound, but we do need more money directed now here.
Absolutely. So those in support of unanimous again. So thank you very much for a very rounded debate. Next item.
Patient transport.
Patient transport.
Oh, it's me again.
Claire.
I need to get out more, don't I? Really.
Alison, would you like to introduce this? Are you up for introducing this?
Yeah. Thank you. And I think after our previous conversation, perhaps we perhaps should have done it the other way around, but we'll kick off where we are, and I know probably the direction of travel on this. What I've done is submit to you a really brief summary of a consultation that's currently in place from NHS England around patient transport services, because this is funded from a central pot. It's looking at really trying to get through on three major objectives, looking at the patient transport that needs to be high quality, needs to be consistently patient-centred, it's minimising waiting times, keeps people informed, and integrates transport into treatment pathways and gives people who are receiving the treatment more independence and a little bit more control. There are national criteria that we have to follow, and there are consistent standards, as you would expect when you're transporting patients to and from either treatments or homes or their normal place of residence. And also they're looking to be a zero carbon impact from those services. They're hoping out of the national review of the national framework and the consultation that's in place, there are 5 components they're looking to address, which is the eligibility for transport, the wider transport planning and for journeys for all patients, increased transparency, and as I mentioned earlier, zero carbon and a better procurement and contract management. They have set out the timelines for this, for the engagement events with commissioners will be taking place from this autumn. And clearly the Isle of Wight Trust, as our current holders and providers, along with others, are a key factor in this, and we're already engaged with them. The final eligibility guidance will be issued in early 2022, and then they hope to begin on their mission of providing that care. Now, Paul and I have had several conversations about patient transport because we are aware that transport services and ferry travel, because it's a minimal impact for the rest of the UK. However, it's significant for us, as we all know, because quite often, whether you're a patient wanting specialist services that are held off island, or you're wanting to visit a patient and maintain those very close contacts, getting on and off the island is so important. And of course, we can't ignore the fact there are some emergency situations where patients have to be transferred in a matter of urgency and within a very tight timescale. So there's clearly a huge impact of this consultation that we need to take into account. It's really important that we engage fully, that we make sure that the island reliance on ferries and transport across that stretch of water is recognised and understood. And how we do that, I think, is going to be to make sure that we make sure the lobbying voice for us is very, very strong, and to really reflect in terms of the criteria they're looking at, that has to be taken into account. So we have the autumn to engage. I'm hoping that in terms of the engagement, we will include all of you as councillors, as well as more of our voluntary sector, our hospice and our other providers who help support people, alongside those who also offer transport for patients who are travelling to and from the island as well. So I'll just pause there because it's a consultation document. There's clearly a lot to do. There's clearly a lot of engagement we've got to get right, and just pause there for questions, John.
Thank you very much, Alison. I have Joanna Smith, Health Watch.
Thank you. I just wanted to mention again the importance, you've already mentioned it, Alison, about that ferry crossing and the impact it has on people. We've just done a report for the Wessex Cancer Alliance detailing all the feedback we've had about cancer services over the last 18 months. And a big theme in that feedback is relating to travel and transport for people. And part of it is relating to cost, but most of it isn't. It's the impact on people. It's the unreliability of the ferries sometimes, both during COVID and without COVID. It's the stress and anxiety of people having to travel when they're unwell, when they're immunocompromised. And we're also finding that people are having to travel unnecessarily. So people are still going to Southampton or Portsmouth hospitals for a blood test or even COVID tests prior to surgery, 3 or 4 days prior to surgery. And it doesn't make sense for people to travel on a ferry to get a COVID test and then come back on the ferry and then go back for an operation. So hopefully there'll be better coordination with our partner agencies to reduce the number of, to limit the travel that people have to face, and see what can be done locally to avoid travel, and also to maximise the use of IT and video conferencing and telephone calls that again will minimise the need for patients to have to go off island.
Thank you, Joanna.
So I'm
Could I ask a question?
Sorry.
Sorry, Alison, carry on.
Would it be possible, Joe, would you be able to send me that draft? Because I think it's really important we take some of that learning and include it in the consultation.
Yeah, happy to share.
Great,
Thank
fantastic.
You.
So, Councillor Mosdell.
So I got given the recommendation, so I'm going to do it backwards. Usually you end the meeting with the thing with the recommendations. So I think I'll read out the recommendations first and then just give a little thing that I need to add to it. So the recommendations that we had to the committee is that the integrated care partnership either re-establishes or re-energises the working group looking at patient transport as a matter of urgency, and this should ensure that all public transport operators are fully engaged in the process, which minimise the financial and practical implications of patients using public transport for the purpose of attending medical appointments both on the island and on the mainland. The second recommendation is that representation be made to the Accessibility Minister, Chris Heaton-Harris, and the island situation should be fully recognised by the inclusion of data for ferry travel in the National Travel Survey undertaken by the Department for Transport to ensure that residents, particularly those with disabilities, have better access to public transport and a bigger say in how they travel as part of the government's National Disability Strategy. Third recommendation is such data should also specifically show travel for medical purposes to assist both the Department of Health and Social Care and NHS England in assessing the planning and delivering of health provision. I just want to add something to it that, thank you. 13 years ago, my dad had stage 4 lung cancer. He actually passed away within 6 weeks of being very poorly. When we were told that my dad was basically in Southampton and we were told that he was terminal and had a limited lifespan, he wanted to come back and pass away in the hospice on the island. Trying to get anyone to transport him back to the island was a nightmare. So I brought him by car. We're lucky that we're in a financial situation that we could afford to pay what was then a very expensive ferry journey. I did everything to inform the ferry that I didn't have a seriously ill man in the car, I had a dying man in the car. We got to the ferry and the ferry operator wanted me to get my father out of the car. At this point, my dad looked like something out of Belsen. I had a very strong argument outside the car with the ferry travel. They didn't let us on that ferry. We had to wait for the next ferry because of some bizarre rule that the MCA apparently have made, which today I have never ever found that detailed ruling that says that you can't stay in your car on that journey. I've never found it, and as you can imagine with our experience, I really did want it. I was very forceful and we did wait for a ferry, but it isn't just the cost of the ferry, because actually when you're offered for patient travel a 10% discount on a ferry this weekend will cost you 200 quid to get on and off the island. So if you were offered whatever discount on that £200, financially it's suddenly, you know, out of people's reach. And also, you know, we need to sort out this. People need to be able to stay within their vehicles. And you know, I brought my dad home and I wanted him to be able to have that journey with as much dignity as he could. You know, I shouldn't have had to sit at a ferry terminal, you know, given my father or a morph to help his pain for that journey. And sadly, you know, I fought for 4 years for patient transport, you know, and travel and see what we could do, but nothing's changed. And I really want some assurance at some point that, you know, we make not only the cost of the journey, but the experience of the journey, if you do have to travel, something that's one, affordable and that people can do safely and with dignity.
Lots of agreement there. We've got a proposal, we've got a seconder. Carl, would you like to?
Just briefly to support every word that you've just said there, Claire. Sorry, Councillor Mosdale. And to state that we are experienced on top of that. So Councillor Phil Jordan is engaging with cross-Solent transport because it goes beyond that. It goes to the point where this weekend the ferries are so busy that people cannot get on those ferries for their appointments in Southampton, and so there needs to be a priority system for patients who are commuting from the island and back again, so that they can actually use the ferries rather than them being treated as they have done previously as a second-class citizen paying a reduced fee. So the priority is health and well-being, not the issue. You know, so the issue is important, but the person comes before the transportation issue, which means that they get priority always, and that is something that we absolutely must address right now because it has become critical, and our public health director has actually left. I mentioned it with him and discussed that this week, that we cannot get patients onto the ferries who need their essential chemo, radiotherapy and everything else this week, because the ferries are full and they are not prioritised within the waiting list. So there needs to be a better system, which I'm sure that our colleagues in the NHS can actually, we could work together on a really positive campaign for that, and I look forward to that.
Thank you very much for that, Carl. So we'll go straight to the vote then. So all those in favour of the proposal?
Unanimous again.
Unanimous again. There's a surprise. Thank you very much. Again, I think we've got consensus across all health partners. Very strong point. Another example of how we're disadvantaged by as being an island, and that disadvantage is not fully recognised. So I don't know. I think Bob's left, and so is his office still on, but we can. I know Bob has been fighting very hard for ferries, but we'll brief him with what's been discussed and agreed across the board. Right now, updates on significant service issues. So I'm going to start with Laura, Director of Adult Social Care, and congratulations on your post, Laura. Very nice to hear from you always. And you haven't said that much, but I'll give you another chance.
Thank you, and I don't propose to say much more, if I'm honest. The issues currently affecting adult social care are well rehearsed. We've touched on some of them this evening. Workforce pressure continues to be something that is a live issue for the local authority, and that workforce pressure is being seen right across our health and social care system, from my own frontline social work staff to people delivering care and support in our communities to our staff resources up at the hospital. It's not a situation that's peculiar to the Isle of Wight. It's part of a wider national picture, and it's a national picture that will continue to escalate to anyone who will listen, in the hope that we can find a long-term solution. In terms of other pressures affecting adult social care, our workforce situation isn't assisted greatly by the deadline next week for all care home staff to have received their first vaccination, with their second vaccination mandated to have been received by the end of October to enable them to continue to work in care homes. The deadline for that vaccination programme is the 11th of November, and following on from the 11th of November, any member of staff in a care home or any professional visiting that care home other than in an emergency will need to be double vaccinated, or will be unable to work in that environment any longer. We're providing support to our workforce and to providers to ensure that people have enough information to make an informed decision around their vaccination status. Simon Bryant, Alison, and the work that their teams are doing in terms of promoting the vaccination and the positive impact of that for people is something that's really stood us in good stead to improve our vaccination levels. At the moment, and for this committee, the anticipated impact for the Isle of Wight frontline care home provision is in about 5% of the workforce, so a smaller number than we're seeing nationally, where the workforce impacted is in the 7 to 10% range. So we're doing well is my key message, but we're not taking our foot off the pedal, and we'll continue to monitor that situation closely. The only other area I wanted to flag for you today is one we've already dealt with in terms of funding, so I don't propose to go into any further detail in relation to the MP's announcement or what it means for us as a local authority.
Thank you, Laura. Darren, any significant updates that we haven't already dealt with?
John, I would just echo Laura's comments. Actually, workforce remains our biggest single challenge for all the reasons that Laura's outlined. And we continue to work both with inside the organisation, but also across the whole system, including social care, primary care, and everywhere really, to try and make sure that we have the right people in the right place doing the right things. But it is a challenge. It is definitely a challenge, and it isn't just money. It's a big factor, but it isn't just money. It's availability, and that's something I think we need to come back to.
Darren, can I ask you? Do you discuss this at a higher level with the council for a joint strategy on workforce? Because I believe we've got higher than national average unemployment on the island?
Yeah, we do, John. We've recently set up what we call a system workforce group, which is the kind of officer level delivery of the intention of the CEOs.
Thank you, Darren. Michael, do you want to ask your question now, or shall we hear from Alison first?
No, Alison.
Alison, from your perspective.
Many thanks, colleagues. I think I've shared actually some of our big ticket items as we've been talking, so I don't have anything to add at the moment.
That's fine. So we'll go to Michael's question.
I mean, but basically, it's also, I mean, a suggestion. You know, workforce recruitment is extremely important, but also I think there's certain realities. I had a meeting with the job centre managers recently, and you know, we have obviously since COVID a high number of people that are on benefit, but there is a lot of jobs out there, and there is a lot of care jobs there. And what I was told is that people passed those, right? They did not want to go for those vacancies with it. And I think we do need on the island to have a discussion, and I'm going to suggest we put it on our work plan, about this issue of workforce is recruitment, because in some cases we've got to recruit off island. In other cases, we've got to have the training and the access. I mean, you mentioned like to Portsmouth on dentistry, you know, just one. We've actually got to have the pathways for future people within our care system, in our hospitals. And I think we've just got to perhaps come together and, you know, problem shared, as it were, the phrase, to actually look at imaginative solutions that we actually try and resolve this issue. It has been an issue before COVID, and I think it's an issue now. But yes, there are people on the island that need work, but we need to encourage and entice them to go into professions and things that have vacancies. I know that there's a particular issue of the construction industry, which I know Councillor Mosdale and Councillor Nicholson have raised. So there is this workforce recruitment. So I'm going to suggest or propose that we put it on our work plan to actually look and discuss in the future, because our colleagues all need help with this particular issue.
Councillor Mosdale.
So I'm probably doing the CCG and Laura's and the ICP's work here. I know that there has been lots and lots of, there is part of the local care board, or the ICP as it's now called, a very focused look at integrated workforce and how we work together in training and stuff like that. There's always been an acknowledgement. I was in a meeting the other day and heard Maggie Oldham, the chief executive, saying the disparity there is between pay rates that could be that if you went to work for the hospital or if you went to work within social care on the island. You know, there is that level of understanding from the NHS across because of what the ICP does. Workforce is the local care board meetings. It's on the agenda. It always has been as part of it. So I was in a meeting that Maggie Oldham was giving a presentation, which was the presentation for Here Is This Forum. So Maggie gave us an update. Yeah. So don't worry, I wasn't in a meeting I wasn't meant to be. Don't worry about that. So no, she gave us a presentation to hear and acknowledged that disparity, you know, of pay rates and things like that. Rather than reinvent the wheel on workforce, maybe it would be good to have at the next meeting a presentation from representatives of that integrated system of what they're doing and how they're moving forward with workforce specifically. Maybe that's an idea to do that, rather than us all go off and do something when work's actually being carried out and workshops have happened.
I think that's the purpose of putting it on the work plan. We come back at a future meeting.
But we do also have to have that understanding that this has always nationally goes back to, Laura and I have both had it, I will always come back to my daughter being threatened, the naughty one at school. If you carry on behaving the way you're going to behave, you're going to end up working in care. So, this needs to go back to grassroots. We need to make sure that people have yeah, but that's what my daughter was told. You know what I mean? It's that level of respect, understanding going through the school system, but also paying people who work within care the right rate of money for doing it. Because you're going to go stack shelves and
I think it's
Sainsbury's
agreed.
and get more
We're going
money.
to put this on the work plan. Yeah.
People do ask me why I'm doing it, and I say because I really, really enjoy it and I'm making a difference. Same reason I'm a councillor.
Darren, did you have your hand up? Was that left up?
Councillor Nicholson, it's really just to support the proposal there that putting this item onto the work plan. That system workforce group that I talked about earlier on will be the way that we'll develop and then deliver the requirements. And I think it would be really good for Scrutiny to get a report back.
Thank you very much for your support, Darren. Right, so that takes us through to the work plan. Members have seen the work plan, and we've now got another item on the work plan. And that brings us now to the last item, members' questions. Any questions?
None notified.
None notified. Joe, is that you got your hand up? No? It's like being in an auction, Joe. Right, with that, I think we've had a very good meeting, covered an awful lot of issues. We've had a full and frank exchange, robustly as always, but I think it's a lot of good's come out of it. So thank you very much, Health Partners. Look forward to seeing you again, and don't forget any issues. We're always willing to meet informally to discuss, and keep up the good work. Thank you, Laura, and we look forward to seeing you for a long, long time. Thank you, Health Watch. Thank you, Cabinet Member. And thank you, members of the committee, for your participation.